So next I'll discuss some of the diversity in the payloads that we're seeing. There are now at least 19 different payloads for ADCs that have been tested in clinical trials. This does include some of the ADCs that have been discontinued, but it also marks a significant expansion since 2013. And there are actually likely to be other payloads that are already in the clinic, but yet to be disclosed. So there's a few ADCs that have a novel auristatin or a proprietary or undisclosed payload that that have entered the clinic, and so we're looking forward to seeing what those are and where they fit into the payload diversity. So looking at the different payloads in different phases of development, we can see that the majority of the diversity and the variety is in phase 1, whilst there are fewer payloads in the drugs at later stages of development. Starting with the pink color, we can, at the bottom of each of the graphs, we can see that there are at least 7 different auristatins in the clinic, with another that is currently identified as a novel auristatin to make 8. So far, only MMAE and MMAF have progressed further than phase 1, but the other novel auristatins I'll discuss a little bit more on the next slide. Next, in green, we have the maytansines, the DM1 and DM4, both of which are well established with several ADCs in multiple different phases. There are now at least 2 different PBDs in the clinic, talarine and tesirine in purple, with other drugs listing PBD as their payload but not disclosing any more details than this at the moment. So we're unsure, and I'm sure in the next year or in the next few months or year, then we'll find out whether they're a new PBD or whether they are one of the known PBDs. Then in kind of the orange and pink, we've got the topoisomerase inhibitors. So SN38 is the most established, with 2 different ADCs in the clinic, the Immunomedics compounds. And then Daiichi Sankyo have a new topoisomerase inhibitor, DXD, that's also in the clinic. And towards the top of the graph here, in blue, we have some other different payloads that fall into a different mechanism of action, as well as in pink, salmon at the very top is the antibiotic drug payload. So I'll just discuss a little bit more the payloads in a little bit more detail. What do we currently know about these novel auristatins? So Pfizer have their proprietary auristatin 0101. This is found in 3 of their ADCs, of which 2 have unfortunately fairly recently been discontinued. But it is still found in their PTK7 targeting ADC that is in collaboration with Stemcentrx. Amberstatin is Ambrx's novel auristatin payload. This is conjugated via non-natural amino acids to their antibody, their HER2 antibody, to make their ARX788 ADC. And then we have 2 different payloads from Bayer. These were originally both described as a novel auristatin, and we didn't know whether that they were the same auristatin or 2 different auristatins, but they have 2 different proposed non-proprietary names. So amidotin is found in their C4.4A targeting ADC. It's a dialkyl auristatin, whilst ixadotin is an auristatin W analog and is in their FGFR2 ADC. So in terms of what do we know about the novel PBDs, so more information is coming out all the time for these PBDs. So the talarine is is the payload that's found in vadastuximab talarine and in Seattle Genetics CD19B. It's also known as SGD-1882, and it's site-specifically conjugated to the antibodies via cysteines. Meanwhile, tesserine is found in Rover T and in ADCT 301 and ADCT 402. This uses an SG3199 warhead that's coupled to the linker to generate the SG3249 payload. So some of the other novel payloads that we're looking at, M-Meta, this is the tubulysin variant that has been developed by AstraZeneca and is found in their biparatopic HER2 targeting ADC. DGN462 is ImmunoGen's indolinobenzodiazepine dimer, found in their 779 CD33 targeting ADC. And then DXD, as I mentioned earlier, is found in Daiichi Sankyo's DS8201A. This is a topoisomerase inhibitor and is an exatecan derivative and produces a high drug to antibody ratio of about 8 to 10 in their HER2 targeting ADC.